Dr. David Greene, founder and CEO of R3 Stem Cell Pakistan. So today we're talking about COPD and pulmonary fibrosis treatment with stem cell therapy. So what do we mean when we're talking about COPD or pulmonary fibrosis? Well, they're really on the same spectrum, but COPD involves damage to the lungs, oftentimes from smoking, or there are some various diseases that can cause problems where people just can't get enough oxygen in. Sometimes they have to use supplemental oxygen, and it can be a real damper on enjoying, with quality of life. People can get very winded with just a few steps, not be able to do much activity, end up getting kind of overweight, maybe needing to sleep upright. It can really affect someone's ability to do their just activities of daily living. Pulmonary fibrosis, the word fibrosis means scarring. So basically the lungs are scarring, and it can do a lot of the same issues with helping people get enough air in. They might need supplemental oxygen. It might affect one's ability to work. For instance, if someone has to stand up a lot during the day, they may just not be able to do it. So when you look at the traditional, conventional medications and treatments for COPD or pulmonary fibrosis, they are not great. A lot of times it includes inhalers to help try to open up the lungs, might include some supplemental oxygen, like I mentioned, and other medications that really don't change the structure of the lung. They don't change the course of the disease condition, so to speak. So when you look at stem cell therapy for these lung diseases, COPD and pulmonary fibrosis, it truly has been a game changer in the way we approach these conditions. Stem cell therapy is very safe. Our centers worldwide have done over 16,000 procedures in the last 10 years, and we've never had a significant adverse event. So when you look at stem cell therapy as we give it here at the center, say in Pakistan or Mexico or the Philippines, it's no different. We have a very high quality for the biologics. They come from an FDA approved lab in the United States, and the origin is from donated umbilical cord tissue. The tissue does not have embryonic stem cells. There's no obtaining it from aborted fetuses. It's a very ethical process. These are consenting donors after a scheduled C-section, and there's no harm to baby or mother. Like I said, it's an FDA-approved lab. The tissue gets tested for every type of infectious disease you can think of. The FDA has a huge list. And we bring it here from the U.S., cryogenically frozen on dry ice. And it stays that way until 20 minutes or so before your treatment. The treatment is administered through an IV, very simple, you pick the arm, and through a nebulizer. We want to get as much of the stem cell biologic into the lungs to help facilitate the repair and the regeneration as much as possible. So what are the results for the stem cell treatment for COPD and pulmonary fibrosis? Well, here's what we see very frequently. Within a month, maybe 6 weeks, it's not going to be overnight, patients start to say that they're able to breathe easier, walk farther, do more of the activities of daily living that they've been missing. Their energy goes up dramatically. And we're not talking about, a 1 or a 2 month benefit. Patients realize benefits that are usually 1 to 2 years. And along with this, we are going to recommend that a patient stop smoking, if that's one of the underlying issues, or help additionally with the fibrosis or whatnot. One of the questions we get asked a lot is, should I have the treatment now, or should I wait till it gets, as bad as possible? Well, that's an easy question to answer. Stem cell therapy is not going to take lungs that are very, very scarred and fix that, okay? There has to be some tissue that's not scarred to help make that tissue work a lot better and to function and help with, the things I just mentioned. So the best way to approach it is to get the treatment as soon as possible after these issues start. Because at a certain point in time, a patient is just not going to be a candidate, okay? If we can halt the progression of the COPD and the fibrosis, then patients get a much better outcome. We can simply repeat that treatment in 1 to 2 years as necessary. And like I said, it's been a very, very safe opportunity for patients. Here in Pakistan, we have several locations for R3 stem cell clinics. The phone number to call for a free consultation is 051-889-6711. Our headquarters is in Islamabad, in the Jahangir Multiplex near Golra Moor, H13, Islamabad. We also have additional locations in Lahore, Faisalabad, and more coming soon. Thank you for watching.